There are some shocking changes when it comes to Medicare Advantage plans in 2025. So in this video, I want to talk about what are we seeing and what you can look out for to avoid the same surprises that can impact your healthcare that you get in the coming year. I'm Emily with the Medicare Coach. We are a Medicare consultant helping our clients easily navigate both the Medicare rules and the insurance company options to get what's right for you to have that best healthcare while still protecting your financial savings. So at this point, we are reviewing 2025 Advantage plans. And we're seeing normal changes like we do every year, but there's one unique one. So we're seeing things like we normally do, like change in premiums, change in deductibles, change in copays, change in perks, change in medications, all of those things. That's very, very common. We want to watch out for every year. But one of the surprising things that I'm seeing more so this year than in past years is doctors' offices and hospitals and big facilities leaving or at least changing the Medicare Advantage plans that they are accepting. Now, some of you are lucky and are getting the heads up when your doctor is no longer going to be in network, but not always. I have a client right now who has very aggressive cancer. He is at MD Anderson, and MD Anderson is dropping one of their big Medicare Advantage plans. So he's trying to figure out what to do because he's mid-treatment for his cancer with his chemo, and he's like, what options do I have? And I think what's hard is this is not abnormal for Advantage plans, but it's always disruptive. So they're dropping this plan as of November 1, so we're kind of stuck and not in a great place for the next 2 months until we finish the calendar year out. But we can switch into a new Advantage plan in the upcoming year that will cover his doctor. So that's great. But my point is this. When we first join Medicare, we go through the whole thing. We're going through what your priorities are, who are your doctors, which is most important to you, the cost, are you moving, employer plans, retiree plans, all the things. But I think it's important that you review at least your doctors, your medications, your priorities, as well as your costs every single year. Again, it can be hard to leave a Medicare Advantage plan and go back to a Medicare supplement plan. But there's still things that can be done within Medicare Advantage, at least in most cases, to get you the best care for the upcoming year. But again, look to see what are the changes to your plan, especially on your providers, and pick that right plan for the upcoming year. Now, yes, you have another window at the beginning of the year to change those as well, but I think it's best to just do it now, get it right in this period of time right now from October through December, and that way you're set for the upcoming calendar year. So I hope you found this helpful. I'm going to put some extra resources down below to give you an additional shortcut to Medicare, so it will help you again easily navigate the whole system to do what's right and best for you. And if you found this helpful, give us a thumbs up. Make sure you follow along so we can give you more inside tips when it comes to getting your best Medicare coverage.